Alright, welcome back to Phlebotomy Solutions Video Presentations DVD, Volume 2. In this one, we're going to be talking about universal precautions and safety in the workplace. We're going to be talking about the different agencies such as OSHA, CLIA, MSDS, and HIPPA. Now, OSHA stands for Occupational Safety and Health Administration. CLIA is Clinical Laboratory Improvement Amendment. MSDS is Material Safety and Data Sheet. And of course, HIPAA is Health Insurance Portability Accountability Act. Now, these four agencies regulate the different safety guidelines and policies and procedures within a laboratory, hospital, or even in a medical facility. They can also do the same for any classroom or office that deals with safety and hazard in the workplace. It doesn't have to be medical related as well. So we're going to be talking about these four different agencies and how they will help you in your day-to-day workplace in the field of phlebotomy. Alright, in safety hazards in the lab, we're looking at four different areas. We're looking at bloodborne, which is anything that's blood related; chemical, that's any chemical-based component that's in a lab or a hospital, or again, anything medical or even classroom related; of course, electrical, and that includes all your outlets, anything you have to plug in that runs on electricity, of course. And again, that goes even outside the medical facility, your classrooms, your work environment. But right now we're going to look at your labs and, of course, your hospitals. And, of course, anything that's fire related. In other words, if you have a danger of a facility possibly catching fire through electrical or chemical issues in the workplace, then, of course, this becomes a fire hazard. So, again, we're going to be looking at bloodborne, chemical, electrical, and fire in the hospital or laboratory workplace. Okay, let's begin with OSHA. Now, OSHA stands for Occupational Safety Health Administration. Now, you must remember these acronyms for these agencies because they will show up on the test. Now, OSHA sets a set of requirements for employers to follow to ensure the following: occupational exposure, bloodborne pathogens, and of course, potentially harmful substance. Now, that's pretty much any type of potentially harmful substance in any facility, any bloodborne pathogens, and of course anything that's occupational exposure hazards in the workforce, hospital, or lab. Now, who is responsible to comply with all OSHA regulations and enforce guidelines? Well, OSHA guidelines apply to all clinical environments, even in the classroom. Now, again, because the classroom, you might be using chemicals in the classroom, you might be doing injections or even drawing blood. They are also under OSHA itself, as well as any clinical laboratory environment. Now, California is not only governed by OSHA, but also Cal-OSHA. Cal-OSHA is more strict than OSHA alone. So you have another agency under OSHA for the state of California that is called Cal-OSHA. Now, they can pay a visit to any facility and then report to OSHA anything they see that could be a hazard in the workforce. So again, you got to be very careful because now you're dealing with two agencies, OSHA and Cal-OSHA, and both have their own strict rules, policies, and procedures to follow. Now, meeting the OSHA standards is not optional. Failure will result in a fine that may total $12,000 for each employee. What that means is if OSHA comes in and they discover a violation of OSHA, then they can go ahead and start fining for every employee that works in that facility up to a minimum of $12,000 and up. And here's the thing: if further violations continue, then they can go ahead and close down the facility itself. Now, if they go in and decide to shut down a lab, that shutdown of the lab can pretty much shut down the whole hospital itself. Without a lab, the hospital cannot run. So again, we must abide by OSHA rules, guidelines, and procedures. If we fail to do so, these are the consequences: fines and possible closure of the facility. Alright, let's talk about PPE. PPE stands for Personal Protective Equipment and includes, but is not limited to, gloves, jacket, face shield, goggles, and proper shoes. Now, proper shoes is talking about wearing leather-based shoes or even the fake leather or the hard plastic croc type shoes, because if you wear cloth shoes like Vans or Converse, you can soak up blood in the cloth, and if you drop a needle, it will go through the cloth of a shoe and stick your foot. Therefore, hospitals and laboratories will not allow cloth-based shoes. They must meet the requirements of the hospital. So whatever your hospital facility has for proper footwear, it must be met. This is part of your dress code in any facility. Now, PPEs alone usually does not adequately protect the healthcare worker from needle sticks. What that means is that a needle can go through your gloves and stick your finger. It can go through any of your cloth of your jacket or your scrubs. And of course, if you're not wearing the proper shoes, it will go through cloth and stick your foot. All right, let's take a look at a PPE fashion show. Now this worker here has her hair protected, her eyes, and of course her nose and mouth. Now this could be a possibility if you're walking into a patient's room and this patient is of course in isolation. Now this has happened to me where I've gone to a patient's room and they have a head lice, and of course on the outside it says you must wear these protective equipment. Now that means your hair, protects your hair from any lice, as well as your eyes, your goggles, and of course anything that might be airborne. You want to protect your nose and mouth. So again, patients could be in isolation and might require hair, mouth and nose, and of course your standard goggles from bloodborne pathogens. Alright, next you might encounter, if you're dealing with chemicals in a lab and you need to use PPE, you might of course be wearing a hair protection, of course your nose and mouth. You don't want to inhale any kind of chemicals, as well as utility gloves to protect from any kind of chemical burns. So this is a good example of PPE, personal protective equipment, where you're dealing with chemical elements in a lab or a facility. Alright, let's talk about the different types of gloves you could be using in a hospital or laboratory setting. There are different lengths and styles. Some are latex, others are vinyl or nitrile gloves. Some are sterile, some non-sterile. For example, if you're working in a lab and you're dealing with chemicals, you'll be using more of the rubber utility glove. These are thicker gloves to help prevent chemical burns or chemical skin irritations that might happen during a chemical spill. So they're designed to protect you. They go past the wrist, probably midpoint of the forearm, and they're really thick. Now, if you're just dealing with patients, you'll probably be using more of either the nitrile gloves or basic standard latex gloves. The difference is nitrile gloves are typically latex free. So if you do have a patient who's allergic to latex, then you'll be using nitrile gloves. Now, even a patient might have a reaction to nitrile gloves, you might have to use vinyl. Vinyl is more transparent, it's thinner. It's the kind you might see at a restaurant where food handlers use. Those are vinyl. So if you have a patient who can't handle latex, nitrile gloves. If you have a patient who can't handle even nitrile gloves, then we go to vinyl. Now, the difference between sterile and non-sterile is that sterile comes right out of the package, sealed, right onto your hand. So if you're going to a surgical room and you have to draw blood, you'll probably be using sterile gloves. Now, non-sterile, of course, is the kind that just come in a box. You have so many gloves in a box. They're open, they're exposed, you take them out and you use them. Those are non-sterile. So make sure you understand the difference between sterile, non-sterile, latex, latex-free, and vinyl. Also the rubber utility glove. When you use them and how you use them is important. So again, make sure you understand the distinction between each glove and the proper usage depending on the patient you're handling or if you're just using chemicals. Now there are also different types of eye shields, goggle style, and different facial shields as well. Now the picture below shows a standard eye goggle for drawing blood. These are what you'll be using in a hospital laboratory setting with just handling or drawing blood from a patient. Now a face shield is required if you are in the lab processing blood. So if you have blood in your hand and you remove the cap from the tube, or even urine, if you remove the top from a urine container, you need to have facial shield on. That is an OSHA requirement and also part of a laboratory and hospital standard. So you could get written up if you do not have the proper eye or face shield while you're either handling blood in a processing room or you're dealing with patients while you're drawing blood. So every eye shield, goggle, or face shield is required given the different situation. Now some phlebotomists will go out and buy their own goggles, which are thinner, more of a thinner piece that goes around the eye, which is perfectly fine, and as long as you get approval from the hospital and then it meets the standards set by OSHA in your hospital laboratory setting, they could be used. But you need to always have eye shield protection. Either different types of goggles are fine, and of course face shields whenever you're processing blood. That is a mandatory requirement in every hospital laboratory setting. All right, now in this picture you see disposable outerwear garments. These are one-time use disposable gowns. Even the headpiece, the mask, and even the booties that protect the shoes. So if you're dealing with the patient in isolation, and you need to go in there with to draw blood, you'll be using disposable gowns and caps and masks that might be provided outside of the room. So you need to understand these are one-time usage. Wear them once, throw them in the trash. Special situation, special circumstance with the patient, that's what you'll be using. So remember, always wear your PPE, personal protective equipment. That does not guarantee that you won't get stuck by a needle, because needles can go right through gloves. But it does help protect you from cross-contamination, chemical spills, and blood that can splatter on your face if you're not wearing your goggles or your face shield. So always wear PPE whenever you're processing blood, drawing blood, or handling any kind of specimen in a laboratory. This is an OSHA hospital and laboratory requirement. Now, needle stick injuries among healthcare workers. RNs are listed at 49.7% who are among the most injured in a hospital due to needle sticks. As you can see, physicians or MDs are at 12.6% at the bottom, and of course phlebotomists are at 4.5%. Now again, these are the most frequent needle stick injuries in a hospital and even in a laboratory setting. Now nurses, of course, they're higher because they deal with needles on a regular basis due to giving injections, starting IVs, and occasionally drawing blood. Now, the majority of needle sticks occur when healthcare workers dispose of needles, administer injections, draw blood, recap needles, or handle trash and dirty linens improperly. Now, these 5 are associated with the majority of needle sticks in the hospital or laboratory setting. Now, when you're disposing of needles and you improperly dispose of it in a sharps container and you don't cap the needle properly, or you put your hand in while you're putting it in the sharps, you are at a risk of sticking yourself, and this happens. Or if you're an RN or an MA and you're administering injections and you don't cap the needle properly, or you improperly give the injection and you open yourself up to possibly sticking yourself with a needle. Drawing blood as a phlebotomist, if you fail to do the safety measures and steps that we teach you, you are at a higher risk of sticking yourself before, during, or after the blood draw. And recapping needles, you never recap a needle. That's not an option. You should always set the safety device on a needle you're not going to use and then toss it in the sharps. You never try to recap it just because you are not going to use the needle. You set the cap, you set the safety device, dispose of it properly, and that's it. Now, handling trash and linen, you should always separate your trash from your needles. So if you are working on a patient and you have trash from your gauze you've used or your alcohol pads that you put to the side, never put your needles or anything near that sharp with your trash. A phlebotomist one time failed to do that, and when she went to grab the trash, stuck herself with an exposed needle that was in the trash that she failed to separate and throw away properly. So she ended up in the ER. This happens. You must make sure you follow the safety steps and guidelines, not only from what we teach you, but from what the state requires. So again, these are the 5 that are most associated with needle sticks in a healthcare setting, such as a hospital or laboratory. So question: what types of devices are most commonly involved in needle stick injuries? Answer: unsafe needle devices. In fact, safer needle devices have been shown to significantly reduce the incidence of accidental needle sticks and exposure to potentially fatal blood-borne illnesses, as recorded by the CDC. So OSHA-approved safety devices are recommended when drawing blood or using any kind of needle device, whether you're an RN, an MA, or especially a phlebotomist. Using needles without safety devices is an OSHA violation. And even if they do have safety devices, they should meet the OSHA standard and be OSHA-approved safety devices. So, a safer needle device uses engineering controls to prevent needle stick injuries before, during, or after use through built-in safety features. The common feature of effective safer needle devices is that they reduce the risk of needle stick injuries to healthcare workers. This is why it's important to look at OSHA-approved safety devices when drawing blood or using any kind of equipment that deals with needles. So here's another question. Do safer needle devices prevent injury? They can't eliminate all, but 83% can be prevented. All needle stick injuries are not preventable, but research has shown that almost 83% of injuries from hollow-bore needles can be prevented. Many of these needle sticks can be prevented by using devices with safety features, such as the OSHA-approved safety devices that we spoke of earlier. Now, the only other option is getting rid of needles altogether. Now, here is a picture of a hypodermic syringe with a self-sheathing safety device. As you can see, the needle gets covered immediately after usage. Now, here's a note. OSHA does not endorse, register, or certify any medical devices. Now, we do say OSHA approved, which means that if you had an OSHA inspection and they saw your needles that have a properly safety device on it, they will approve it and you would not get fined. Those that do not have a safety device or does not meet the requirements set by OSHA could be liable for a fine, but they do not endorse, register, or certify any specific medical device. Now, here is a hypodermic syringe with a retractable technology safety feature. What that means is right after usage, the needle gets retracted in by the spring and then gets disposed of immediately. This is a retractable technology that is OSHA approved, so on inspection, you would be okay to have. Another safety device is called an add-on safety feature. That means that the safety device is attached either to the syringe or the blood tube holder itself. So once after usage, you would lock this over the needle and it would lock. You cannot unlock it or remove it once it's put into place. And again, these do meet OSHA requirements, so if you do get inspected, they will meet the requirements set by OSHA. Now, looking at retracting lancets with safety features, we see some of the following here. We see before, during, and after usage. Now, as you look at, you see the safety devices is locked on there before. You remove it, and during and after, it retracts back up. So you have the before, during, the needle comes out, and after, it retracts back in on each one of these devices. The last one shows in use and after use. The needle should not be exposed after usage. Before, you take off the safety device. You use the device with the needle coming out and retracting back in by its spring activation, and there should be no needle being exposed afterward. But that does not mean that you won't have a defective lancet. I have seen devices where once we've drawn the blood, the needle does not get retracted. You must be careful how you handle the devices even after usage. Not just before or during, which is important as well, but also after. I also seen students before remove the safety cap and then accidentally trigger the needle on themselves while handling the lancet. Again, each device needs to be handled carefully. We do have defective devices, so none of them are going to be perfect. But these are the retracting lancets with safety features. And remember, it is always necessary to use safety measures. Always use a needle when drawing blood that has a safety device attached to it. Make sure it meets the standard that's required by OSHA and your hospital. Here are some facts about needle sticks. 800,000 needle stick injuries occur each year in the United States. Bad news? 16,000 of these are likely to be contaminated by HIV. Up to 80% of all accident exposures to blood are caused by needle stick injuries. That means that more than 20 pathogens can be transmitted through sharps or needle stick injuries such as HIV, HCV, HBV, herpes, malaria, etc. Flashing news: HBV and HCV pose an even greater risk than HIV. Hollow bore needles are the cause of injury in 68.5% of cases. This is because blood remains in the bore of a needle and should never be reused after drawing blood. This is why the state of California stepped in to regulate phlebotomy. Phlebotomists were reusing needles by putting the needles in alcohol or cleaning solutions, thinking that this would somehow clean the needles. This does not work. Blood remains in the bore of the needle, and this is where pathogens and viruses remain, And if you attempt to reuse the needle, this is where you can contaminate the patient. Needles are one use only and disposed of. Never reuse a needle. Locations where puncture injuries and other blood exposures occurred. Most injuries occur, as you would probably suspect, in areas where patient care occurs. Injuries occur most frequently in the patient's rooms, in the operating room, the emergency room, or the critical care units. Now, a phlebotomist working in a hospital will move room to these places. They go from ER to labor and delivery to ICU, etc. More high risk for blood exposure when working in a hospital because you do go room to room in all these departments. Now, unless you're working for an independent lab station, then you'd only see patients that walk in, get their blood drawn, and walk out. So again, hospitals are higher risk for phlebotomists for blood exposure because of the room-to-room movement of different departments in the hospital. So when do needle sticks happen? 10% happen during and after disposal, 20% happen before and during use, 70% happen after use and before disposal. Now the 10% means during, that somehow during the venipuncture process you stick yourself with the needle. And after disposal means that after everything's done and you're cleaning up, taking out the trash, putting linen away, you somehow stick yourself with a needle that was not disposed of properly. That's a low percentage. Now the 20% referring to is before, talking about when you are handling a needle before the venipuncture, either uncapping the needle or getting it ready, and you somehow stick yourself with the needle before the venipuncture. And of course during the venipuncture, which means while you're drawing the blood or attempting to draw the blood, you somehow stick yourself there. Now 70%, the greater, is after use and before disposal. So after you're done drawing the blood, after the venipuncture, you somehow stick yourself with the contaminated needle, or you failed to activate the safety device properly, or didn't dispose of it right away in the sharps container and somehow stick yourself during that process. That is the greater risk for a needle stick to happen. Now, the best case scenario for a needle stick, of course, is if you stick yourself with a uncontaminated needle, a needle that has not been used yet. So while you're uncapping it or you're handling it before the venipuncture, you stick yourself. That is a best case scenario for a needle stick. Now let's talk about CLIA. CLIA stands for Clinical Laboratory Improvement Amendments, designed to set safety policies and procedures that protect the patients. They also regulate the laboratory tests performed on specimens taken from the human body. They also set up standards for all laboratory testing to ensure accuracy, reliability, timeliness of patient test results regardless of where the test was performed. Regulations are based on the complexity of the test performed and affect all aspects of the laboratory. Now there are 3 key factors considered in the regulations. Number 1, type of test performed. Testing must be ordered by a physician. Certain laboratories can only perform tests according to their license. Number 2, personnel involved in the testing. Certain tests must be performed by a licensed professional. Phlebotomists have a limited scope of tests that they can perform. And number 3, quality control. All equipment must be in good repair and working according to the manufacturer guidelines. Now let's talk about CLIA regulations. Here are some categories of testing. We have a waiver test. These are simple, stable tests that require a minimum degree of judgment and interpretation. Example might be a visual color comparison and or pregnancy test. Now, number 2, moderate complexity tests. These make up about 75% of all lab tests. This is the job of a phlebotomist. A phlebotomist draws the blood for the physician and takes it back to the lab for diagnostic testing to get a diagnosis for the physician. This makes up about 75% of all lab tests, usually done by blood, urine, or some kind of specimen sample. Now, high complexity tests is most of these are performed by a pathologist and or doctor in a specific field of medical science. This is where you have the specialized tests that we do send out, whether it's DNA, cytology, pathology, and so forth. Again, this is what's governed by CLIA regulations of categories of testing. So let's do a quick CLIA recap. CLIA regulates the type of test performed, the person skilled to perform the test, and of course the quality control measures in a lab or a hospital setting. CLIA is not concerned with the brand names. They do not care of the brands that are used in a hospital or laboratory. So again, these are the three things that CLIA regulates and what they're concerned with. Okay, let's talk about MSDS. MSDS stands for Material Safety Data Sheet. Now, this is information that's obtained from the manufacturer when the chemicals are purchased. And of course, they contain detailed information about the chemical and whether it is a health hazard. Now, statements can be organized in a notebook for employee use and located in an area of immediate access, and should identify hazardous chemicals and use of PPEs and procedures to follow for chemical exposure. This is what Material Safety Data Sheet is and what they do for a hospital or a lab. Here's an example of a Material Safety Data Sheet and what it might look like. So if something does happen, a chemical spill of some sort, then you would take your MSDS book, open it, and you should be able to identify the product, the hazardous ingredients of the mixtures, physical data, fire and explosion if it's flammable, the reactivity of the data regarding the chemical. These are things that need to be looked at if there is an accident or even a chemical spill in the lab. Another example here is regarding the second page. You have some health hazard data. Emergency and first aid procedure is if you get in your eyes, on your skin, or you ingest it. If there's a spill or leak procedures, what to do. Protection of information control measures. And of course, special precautions, what to wear, gloves, no gloves, eyewear, certain things. So the MSDS is a phlebotomist or medical personnel's best friend when it comes to chemical spills or accidents in a laboratory or workplace. All right, let's talk about safety precautions when handling hazardous chemicals. All chemicals must be labeled or in original container. All chemicals are identified by hazardous label. Red, for example, is fire hazard, blue is health hazard, white is PPEs are needed, and yellow is for reactivity. Also, all employees should attend training on chemical safety and precautions. Employer is responsible for providing training and a safe work environment. Here is an example of proper labeling of chemicals. All chemicals should be labeled according to what is inside the container. You should never switch or swap out chemicals into a different container. All containers must contain exactly as the label shows. All right, let's talk about some electrical hazards. You should always inspect wiring of equipment before each use and replace damaged or fried electrical cords immediately, or report them to a technician who can replace them safely. Use safe work practices every time electrical equipment is used. Follow the guidelines, follow instructions when using electrical equipment. Limit the use of extension cords. We do not want extension cords running across the floors where people can trip and fall while walking in the hospital lab. And minimize the potential for water or chemical spills on or near electrical equipment. Again, this is to avoid electrocution or possible fire hazard. Now let's look at a fire triangle. You need three things to start a fire. You need oxygen, you need fuel, and you need heat. These three components, when brought together, can start a fire. So what do you do if a fire breaks out? Well, you need to know how to use a fire extinguisher. The first thing you need to do is pull the pin, aim at the base of the fire, squeeze the handle, and sweep side to side. Another way to remember this is by using the acronym PASS. PASS stands for P, pull the pin, A, aim at the base of the fire, S for squeeze the top of the handle or lever, and S again for sweep from side to side. It's easy to remember how to use a fire extinguisher if you can remember the acronym PASS, which stands for pull, aim, squeeze, and sweep. So remember, when it comes to safety in the lab, we need to look at a few things. One, electrical hazards as possible in our lab or hospital, fire hazards that might be lurking in the hospital laboratory, overfull sharp containers that should be thrown out immediately after they meet the standard line requirement on the sharps container box. And of course, not using standard precautions. Always use standard precautions. These are the basics for safety in a lab. So what makes a successful laboratory program? Well, first thing is orientation for all new hires. Second is periodic drills to reinforce skills. And last, consistent enforcement of policies. These three things make for a successful laboratory program.